Donnelly Carreri, the Chief Communications and Marketing Officer for Bergen Newbridge Medical Center. We are proud to be both the first stop on Senator Cory Booker's 2023 Jersey Summer Road Trip, as well as the host site for today's press conference. Thank you, Senator Booker and his team, for choosing us today and for being here. In addition to the Senator and his team, we'd like to acknowledge a few of our very special guests. Congressman Josh Gottheimer, Assemblywoman Lisa Swain, Bergen County Executive Jim Tedesco, Bergen County Commissioner Tracy Zur, Bergen County Commissioner Rafael Marte, Oradell Council President Tracy Schoenberg, Sheriff Anthony Curitin, Deputy Chief Hector Carter and Liz Rabine from the Prosecutor's Office, Bergen Newbridge Medical Center Hospital Board Chair Julia Orlando, Bergen Newbridge Medical Center Board Trustee, the Honorable Julian Niels, Dr. Anthony Accurso, Bergen Newbridge's Director of Addiction Medicine, Morgan Thompson, CEO of Prevention Links, Anthony Gray Jr. and Kimia Shireen from New Jersey Harm Reduction Coalition, Matt Birchendow, Director of Community Events for the Partnership for a Drug-Free New Jersey, and the many members of the Bergen Newbridge Clinical and Leadership Team, and of course the members of the media joining us today. And our opening speaker, who is known throughout Bergen County as the transformational leader and the driving force behind New Jersey's largest hospital. Please welcome to the podium Bergen Newbridge Medical Center President and CEO, Deborah Visconti.
Thank you, Donna Lee, and Senator, thank you. What an honor and a privilege to have you with us today, especially on such an important day that we're going to talk about. So, Senator Booker, County Executive, our commissioners, our special guests, thank you all for being here. On behalf of the entire Bergen Newbridge Medical Center family, I thank Senator for choosing our medical center and our addictions treatment program to tour and to further the conversation regarding life-saving fentanyl test strip legislation. As a leader in addiction treatment and care, we know this disease. We see the damage it does every day. We see the people whose lives it tears apart. But we also see healing, hope, and recovery. We can't do what we do unless we have the chance to treat this disease and care for those who have it. We just can't continue to watch over 150 Americans die daily from a drug overdose. Those aren't numbers. They are mothers, fathers, children, friends, colleagues, all taken from us too soon. Because addiction doesn't discriminate. It knows no boundaries. It touches all ages. It touches all socioeconomics. And it gives very little warning when it takes hold. We know what's fueling this increase in overdose deaths. Fentanyl, a lethal synthetic opioid obtained easily, virtually everywhere. Fentanyl kills even in the smallest amounts. And the terrifying truth is that it's present in nearly every drug on the street. Fighting fentanyl requires an innovative, boots-on-the-ground, multi-tiered approach. Education, evidence-based practice, harm reduction, anti-stigma campaigns, and widely expanded access to comprehensive substance use disorder treatments, such as the compassionate and diverse programs at Bergen Newbridge Medical Center. These are all keys to saving lives. We all know America is struggling with addiction, and Americans are dying at alarming rates. Leaders such as Senator Booker and our County Executive, Tedesco, understand that this is a public health crisis. We must educate our communities about the danger of fentanyl contamination. Preventing overdoses can only happen through broader access to treatment, fentanyl test strips, and Narcan. Legislative support and funding are vital for us to win this war. Bergen Newbridge Medical Center is the largest hospital in New Jersey and a safety net facility dedicated to providing specialty care for our communities, particularly those traditionally underserved. As a leader in mental health and substance use treatment, we are fighting on the front lines every day to save the communities that we serve. We have worked tirelessly to address the fentanyl crisis and continue to do so alongside government officials, other clinical partners, and hand in glove with law enforcement and social services organizations. Our medical center is uniquely positioned to address the fentanyl crisis and end the heartbreak and devastation so many families have endured from fatal overdoses. But we cannot do this work without continued support, which is why we are so thankful to Senator Booker and the legislation he has put forth, and our county executive and partners for their dedication to working with us to end the opioid epidemic and save countless lives. As a society, we are only as healthy and safe as our least healthy and safe community member. And make no mistake, every day we all become more and more vulnerable to feeling the effects of addiction and fentanyl. Thank you all for being here today. Only together can we create the change needed to end this crisis and create a healthier tomorrow for our friends, neighbors, and loved ones. And I want to give a special shout out to the entire Bergen Newbridge professional family back there, the staff that gives tirelessly every day to fight and save lives and transform lives. So thank you to all my heroes for being here and for the work that you do every single day. And it is now my pleasure to introduce my partner, my collaborator, and the one who's in this fight with me, our Bergen County Executive, James J. Tedesco.
Hear, hear. Thank you, Deb, and good morning, everyone. And when I came in, I had the opportunity to say thank you to all the folks in the back and to all of you here, sitting here, that are here every day on the front lines, making a difference in the lives of the million people that call Bergen County their home, and really the people of northern New Jersey and the tri-state area, because this facility doesn't just treat people from Bergen County, it treats people from all over the metropolitan area. This facility is a linchpin and a key to how we will continue to fight the battle of addiction as it was when we fought the battle of COVID. I'm incredibly proud to stand here today in what is yet another great day for Bergen Newbridge Medical Center. 9 years ago, the county hospital was at a crossroads. Mismanaged and neglected for years by its private operators, this facility was the source of bad headlines and perpetual turmoil. The county administration in office at the time did not care about the hospital and were in favor of wiping their hands clean of the situation. Well, I didn't think that was the right thing to do. Despite its problems, I believe the county hospital, which was and still is the largest hospital in the state of New Jersey and the fourth largest hospital in the nation, was too important to sell. Critical in the administration of the care of our most vulnerable residents. In 2014, the future of this hospital became a major point of contention in my first race for county executive, and thankfully the voters backed up my assessment. Our office, my administration, quickly began putting pieces in place to transform the ownership away from the private management company when their 19-year contract elapsed. In October of 2017, a milestone day, we announced the selection of a new hospital operator, CarePlus Bergen, a new not-for-profit formed by an alliance between CarePlus New Jersey, Integrity House, and Rutgers Medical School. At the helm, we selected a dynamic, wonderful, outgoing individual, Deb Fisconi, as the CEO and to lead this uncharted mission. Thanks to this new leadership team and new county investment, Bergen Newbridge Medical Center is in the middle of the most significant hospital transformation in the entire nation and is continuing its mission of serving New Jersey residents and those in the tri-state area who need help the most. Senator Booker, we are delighted that you have joined us today, both to witness this comeback story firsthand and to introduce legislation that will help communities across the nation combat the ongoing opioid crisis. This epidemic does not discriminate, as you heard. It touches families of all backgrounds and socioeconomic levels, especially here in Bergen County, where last year there were 480 opioid-related overdoses. 480 related overdoses. We have to do better. And sadly, this trajectory is on the rise for another year. That is why my administration made the decision to deploy Narcan to all county facilities and begin offering training to all county employees on how to administer it. But to truly beat this crisis, it's going to take action across all levels of government in coordination with law enforcement, who we have represented here today, our prosecutor's office, our sheriff, and healthcare and behavioral health workers. Senator, I can't thank you enough for coming to Bergen Newbridge Medical Center today. Thank you for your continued support of this hospital, and thank you for your leadership in Washington on behalf of all the New Jersey residents. Now it's my honor to introduce Bergen County's own Senator Cory Booker.
So every year I run around the state during the summer. I call it the 21 county tour, hitting every single county, often multiple stops, to go fully more into a state that I owe everything to. This year we wanted to have our first stop be something really important. Not only am I coming home to the county that raised me, educated me, elevated me, but we wanted to come to a point of an issue that is a national, if not global, crisis. We have a challenge right now amidst humanity. The rates of opioid addiction, the rates of overdose, the rates of death are shocking. We have to, as a community, get beyond this idea that somehow this is an individual moral failing and not a collective moral failing. That this is a shame as opposed to our shame. And understanding that we cannot solve these challenges with the old ways of thinking that seem to want to treat the problem of addiction through the criminal justice system. We have one of the great sheriffs in America here before me right now, and he will tell you that he is not the solution through law enforcement. The solution has to be one begun with how we see each other, how we understand each other, how we know a truth in America that we belong to each other. Too much has transpired in our nation that to me indicates a lack of understanding of what this crisis is about. Our prisons and our jails are full of not just individual failures, but of our failure. We have lost too many of our children, too many of our young adults, too many people, period, to this crisis. And so we wanted to begin here today because we are not just here to describe the problem. We want to bring attention to people who have found a solution. I'm proud to stand between two extraordinary leaders that in a time of failure, they stood up and said, we will take responsibility. Look, Bergen County is great for many reasons, and I'm truly biased as a boy from Bergen County, but one of the reasons why this county is so extraordinary is because of its leadership. The commissioners of this county are not just people I know in their leadership capacity, I know their hearts, I know their commitment, I know their work habits, and I know the county's leader, the county executive. There are few human beings I've met like Jim Tedesco who have in every stage of their lives, from a firefighter to a county executive, shown a level of commitment and sacrifice. But when you see an institution that is failing the state, failing taxpayers, and say, we're not going to just pile on and talk about what's bad, but we are going to see this as an opportunity to build light. That, to me, is great leadership. And the woman that he and the commissioners and others brought to lead this, I am telling you that in the whole horizon of America, amidst the darkness of this national challenge, that she and her team are truly light. We come here today to talk about that hope, to bring attention to that promise, and talk about the work we still have to do. There's a bunch of folks in the back that I just want to highlight before I continue. You know, there's a lot of overuse of the word hero, but to me, I think the people that actually work here are these humble heroes of hope. To steal from Shakespeare, he said, "The quality of mercy is not strained. It sprinkleth like the rain upon the place beneath. It is twice blessed. It blesses those who give and those who receive." Behind the cameras here are a bunch of blessings. People who every day have their own lives enriched by showing a more courageous empathy, by showing the power of love to transform, by understanding that rule in life, that you never look down on another person unless you're reaching out to give them a hand and to help them stand up again. And to know that that's not charity, that is enlightened self-interest. That's the spirit that resonates amongst these hallways. When every day the people that come in here have their dignity affirmed, have their humanity recognized, and know that they are in partnership with others, not just for their own recovery, but for our national recovery, for a restoration and a redemption of the idea of America, that we will be a more beloved community. And so this epidemic has taken too many lives and still challenges every day. But right here in Bergen County, right here at Newbridge, folks are saying enough is enough. When more than 109,000 Americans died last year from an opioid epidemic, folks here are not surrendering to that darkness, but saying we can show a different way. I know this on a federal level. I work with some pretty extraordinary partners. We have done so much for New Jersey in the last 3 years. I am proud of the millions of dollars we have brought back to fight this crisis. But I'm also humble enough to realize that just bringing the dollars home to institutions is not enough. It has to be used by people correctly and effectively, and that's what this institution does. And so I want to say today that our commitment will continue, and that I will be someone who continues the fight. That this crisis is not about locking more people up, it's about liberating. It's about helping. It's not just about health care, but it's about how much we care. I point to communities like this to show that there are solutions. There is a better way, that we can expand upon our work. We cannot go back to failed drug policies that resulted in the land of the free being the nation that incarcerates more people than any other country on earth. We have to take evidence-based solutions like the ones being evidenced here and improve upon them and expand them. We have to take our capacity for compassion and our moral imagination and supercharge it with good people every day willing to do the work. Now, I'm proud to be here today to announce a specific policy. I'm proud to do it with my partner in the House of Representatives, who is part of a caucus called GSD, Get Stuff Done. If he was speaking more candidly, the S might stand for something else. Get significance done, maybe, I don't know. But the legislation I'm announcing in the Senate today with my House sponsor would expand access to life-saving, affordable test strips that can detect the presence of fentanyl and xylazine in various drugs and forms. This legislation comes just a month after I introduced legislation that would decriminalize test strips nationwide. Think about this. We have states in America that still want to make it a crime for someone using a test strip that would prevent them from dying. Together, these two bills will get test strips in the hands of more people. And each test strip costs $1 or $2. What a minuscule amount of money to prevent the invaluable urgency of people dying. And research shows that 81% of people with access to test strips will actually regularly use them. And those who receive positive results from test strips were 5 times more likely to modify their drug use behavior for the good. Studies have shown that distributing test strip devices has been linked to a reduction in unintentional opiate overdose incidents. That's why we're focused on expanding access to these devices as a part of a larger strategy evidenced in the work of the incredible people that are in this room. 50 years ago, a president announced a war on drugs. I say that war was not a war on drugs, it was a war on people. It was a nation attacking and condemning people who fall into addiction. We don't attack folks who get cancer and morally shame them. We don't attack folks who have an accident in an automobile and morally shame them. Addiction is a health crisis, and it must be met by heartened people with enlightened ideas and a commitment to one another. I want to end before I bring up the congressman. I had the incredible honor years ago to work in an institution, to work in an organization called The Bridge. It was a little mental health house in Palo Alto, California. It was the first time I ever sat on a phone counseling people who were considering suicide, counseling folks who were struggling with depression, counseling people who were survivors of rape and incest, counseling people with body image issues. As I said before, when you sit in a position of empathy, in equal dignity, it is not charity. You grow and you learn yourself. I began to see that mental health challenges are just like physical ailments. They're not indicative of a personal failure. They're indicative of a health crisis. But I began to see that our nation had so many cracks, so many holes, so many gaps and gulfs in the provision of mental health care. It began a lifelong effort to try to figure out how do we create more bridges that, like stitches in the wounds of humanity, could sew up, could bind, and can heal. In Bergen County, thanks to extraordinary heroes, extraordinary people, we have a new bridge. Every day, people being lifted across that gulf, across that gap. Every day, people finding humanity and hope and redemption. That has to be America's story. That has to be our way forward. That has to be our avenue towards a more beloved country. I am honored now to bring up the leader of the GSD caucus, getting stuff done every day, the man who represents the hometown in which I grew up, Harrington Park, New Jersey. I am proud that he is one of our own, a great Jersey boy in that pantheon of patron saints of our state, like Bruce and Bon Jovi. I bring up Brother Gottheimer.
You know, there's a couple rules in Jersey politics. One of them is never speak after Cory Booker. So thanks, Senator, for making sure that I spoke after you. Really appreciate that. County Executive, thank you so much for inviting us here today. Deb, thank you for your phenomenal leadership. And this county, as the Senator said, does such a remarkable job between our sheriff and we've got, you know, Commissioner Zur, and I know I spoke to Commissioner Amoroso before, and Commissioner Marte, and I'm getting to Swain. You didn't mention her. You forgot Swain, by the way. So, Cory, I got to step in for you here. In the Assembly, we have somebody who is not only a leader for Northern New Jersey, but also on this issue, and has introduced legislation on testing, and has fought for resources on testing on our committee, which she chairs, and does an unbelievable job as an incredible leader. Thank you so much, Ms. Swain. Doctor, thank you so much for spending time with us, and I could say that all of us who spent a few minutes with you upstairs were certainly moved by what you taught us in those few minutes and who you introduced us to, so thank you so much. And Councilwoman, I thought she was here before, I saw her in the back. Oh, there you are, Councilwoman, thank you so much. Always great, by the way, Bergen County. Just bring that in here. You know, being here with Cory is phenomenal because it's true he grew up in Harrington Park, which is Bergen County, which means that this is his favorite county. Thank you for bringing us all together today and for reaching out on this issue and for your tireless work and fight, not just here in Jersey, but for the issues that you care so passionately about around the country. Because the fact is, we don't just have to get things done here, we got to get things done, get stuff done all over the place. And so whether it's the Affordable Care Act, which you fought tirelessly for to protect, or our air, or our water, or what we worked together on, one of them, which mattered a lot to me my first term, particularly when you welcomed me on criminal justice reform and brought me into the fold, and we worked together, and we got Democrats and Republicans together on an issue which historically wasn't easy to do that. But it just shows you your ability to bring people together, your bridge that you've built in the Congress, in the Senate, and around the country. So thank you so much, Senator. And I don't know what this tour is, but you know, we could just take you around Northern New Jersey if you want. I don't know where else you'd want to go. Last year, working so closely with many folks in this room, we were here at Newbridge, if you remember, to announce that we'd clawed back from Washington to Jersey $2 million for a new federal investment in the hospital's behavioral health emergency department expansion project. That was big news, right? Because when you actually walk the halls here, you see the fruits of this investment. And to our docs and our nurses and our techs and everyone who works in the team here, what you do is so inspiring to anybody who walks through those doors. You're here for 5 minutes, and you feel you understand why every nickel of investment we bring back to this institution is one that pays massive dividends for our community and for our country. And what you do on the front lines is so important. As Cory discussed, we're here to take on a particular issue that we all know too well, unfortunately, here in Jersey. Across our nation, the epidemic of fentanyl and tranq continues to tear our families and our communities apart. About 300 Americans die every single day from an opioid overdose, including communities right here, from literally in this community, and ones next door. It happens everywhere. And anybody who thinks, not in my backyard, is totally wrong on this issue. Totally. It happens everywhere. And people sometimes, I know, are surprised. Really? I can't believe that. It does not discriminate against anyone. Whatever your walk of life, whatever your background, your religion, your race, it doesn't matter. Opioid addiction finds and destroys. That's what it attempts to do. And 2,500 people every year. In the last 5 years, New Jersey lost 2,500 people, but every year this is something where thousands of people die. And the numbers are staggering. The trend has only gotten worse, especially among our nation's children. There is no magic bullet, right? And the doctor was telling us this, right? There's no one-size-fits-all solution to this, right? And this is where we've gotten more advanced and more sophisticated, right? We have to take different approaches. But as Cory said, we know what one of the approaches are. You can't just, as the sheriff knows too, right? You're not just going to lock somebody up and think that's going to be the answer. That doesn't heal folks. We need to try to heal people from a disease. And there's no turnkey solution. There's nothing partisan about this, right? It's why in the Problem Solvers Caucus we work with Democrats and Republicans on this issue all the time, because there is no red or blue around addiction. It goes everywhere. In 2019, fentanyl was involved in nearly 75% of those drug overdoses in New Jersey that I talked about, the 2,500, up from just 4% 7 years prior. Think about that. The statistic is jarring, and it speaks to what this synthetic drug and other synthetic drugs are doing to society. It's 50 times stronger than heroin, 100 times stronger than morphine. Just 2 milligrams of fentanyl, which is about 10 to 15 grains of table salt. You know what salt looks like? 10 to 15 grains is considered a lethal dose. And it gets shipped in. We've seen it come in from China. We've fought against that. It's coming from South and Central America. It comes from all over the world in boxes packed up. It's synthetically made. It's less expensive. It's manufactured in a lab. It's often surreptitiously just cut into another drug. All drugs, including marijuana. The majority of fentanyl is mass-produced in Mexico using chemicals from China. Right? They're often flown or shipped to Mexico, cooked in fentanyl in laboratories. The product is transported by land, sea, tunnels, to safe houses around the country, distributed across America, and it finds its way into every community. And now, we were just hearing about this upstairs, you've got tranq, xylazine, that can now, it's now part of the what do we hear, 80% of the drugs they're now finding has tranq in it, right? That's a flesh-eating drug. Today, with the senator, I'm very proud to help lead legislation in the House that will take on this crisis. It will help. It's another tool in the fight. It's the bill that Cory is leading in the Senate that he mentioned, the Preventing Overdoses with Test Strips Act. It will allow federal and state governments to deploy federal grants to community organizations so they can acquire fentanyl and xylazine test strips. And the idea that we wouldn't use this tool is crazy. We know that if you do, and folks want to, they can find out if there's all in the drug before they use it and somehow find an outcome that obviously is the worst nightmare of everybody. And we wouldn't be taking these steps without the senator. And I want to thank him. Because, like everyone here, we're all committed to tackling this epidemic in our communities. We're doing it with students. We're taking on the students with it, and it's a huge problem coming back into school this year. The Student Athlete Opioid Prevention Act, something that I've been very focused on because we know kids get hurt, and then they get prescribed medication, and then it leads to addiction. We've got to work with the coaches and the athletes and make sure we take it on. We've been getting resources from many of our towns like Mawa. Proud to get signed into law the Support for Patients and Communities Act, one of Congress's most comprehensive responses to tackling the opioid epidemic, including resources for prevention and education and coverage and treatment, and support for law enforcement so they can do their work smarter and better because they do such a phenomenal job protecting us every day, and I'm so grateful for them. With SAMHSA, it's something we fight for in Congress and the Senate. It's so hard for more resources to help improve the response in our state, to take on not just opioids, but mental health issues, and so many problems that, of course, are part of the large. The idea that we wouldn't use every single tool in the arsenal to fight this epidemic, to fight this disease, makes zero sense. We should take everything not just to society, but to life. And that's why I'm so proud of everybody who's here, who does such incredible work every day, especially the who do this, as was said, unsung every day. But they are the heroes. They're our hometown heroes. They are. And we're grateful to you, and we're grateful for what you do for our great country. This if we work together. Thanks and God bless. Amen.
Thank you, Congressman. Thank you, Senator, and thank you, Deb. Our final speaker today is our head of addiction medicine, who's made dramatic changes and strides in just a short time that he's been here. And anyone who was on the tour today, they truly, truly see
you, everybody, for coming today. Thank you very much, Senator Booker, our Congressman, for coming out and seeing the work that we do. Before I start into the prepared remarks, I did want to say thank you to Senator Booker for making us think about why we come in every day to do the work. And a lot of people in here come in every day to our Safety Net Hospital to do the work. And to your point, we are helping people. And we thank you for that. And I think the critical part about the work we do is the dignity of people. And when we're taking care of people in our institution, we are taking care of people with dignity. And the legislation that is on the table today is equally imbued with the dignity of people. We're trying to empower people to take care of themselves, and it's a winning proposition. So I'm glad to be here to talk in favor of it. Realize is that people with substance use disorders are first and foremost people. And Bergen Newbridge Medical Center, from our president and CEO throughout our entire life, takes pride in providing stigma-free, welcoming care to all those in our care. People need to feel safe to come in for treatment, which is why we care for the person with compassion and treat the illness with evidence-based practices. Here at Bergen Newbridge, we provide all levels of care at any stage in the recovery. To us first by first responders or a friend or a family member, and many people bring themselves in, seek care here. So Senator Booker joined us today on a tour of our withdrawal management unit, where he and the senator and the congressman's visits today, working together towards that goal. We and facilities like ours must continue supportive government officials and intuitive legislation matter. And they can be the difference between someone reaching out for help, reaching our doors, or being lost to an over. In 2020 involved synthetic opioids such as fentanyl. According to the CDC, nearly 67% of these fatal overdoses had at least one potential opportunity for These are life and death moments, and why it is critical to provide education on the signs of an overdose. And this is why we have to make Narcan more readily available. And I'll take a moment off script here to say this is naloxone. I have it in But I will take a moment to ask this audience, why is this not available in every library in the country? Why is this not available at the post office? Why is this not available at the... And that's where we have to go if we want to try to help prevent this disease, and also to prevent overdoses even in people who are having active use. So in that same vein, expanding access and funding for substance use treatment programs and providing safety, life-saving treatments such as fentanyl test strips. Test strips are the only way someone with a substance use disorder can know for sure if the drugs contain fentanyl or other harmful synthetic opioids. These test strips are low cost and they save pick up a bag, and this is particularly true of opioids, they do not know how strong it is. And a lot of the time, that bag is less potent than they're expecting. And they feel grumpy because they paid money for that bag, but they're not going to get any effect from it. But the real true danger is if that bag is more potent than their fall out, pass out, and stop breathing. And if there's no one around to administer Narcan, then they will become another death statistic. Now, you can imagine someone who's using drugs who is armed with fentanyl test strips can make a more informed decision about both whether to use and how much product to use. And without getting too technical, I want to draw attention to the fact that for opioid-dependent people, their bodies are used to a day. The test strips will help them, although frankly many of our patients are aware that there's fentanyl in their opioid product. It's not heroin anymore, and our patients tell us that. But where this is critical is for people who are not looking for fentanyl. If somebody has a different drug product and it has fentanyl in it, and their system's not used to the fentanyl, and they don't on our unit right now who thought he was using cocaine. And he came into the emergency room overdosed because there was fentanyl in the drug product. Now, everybody in this audience that had this patient had easy access to fentanyl test strips, he might not have used that particular cocaine. And that is why I'm in such favor of the legislation that's being proposed on. Now, we know test strips are a proven harm reduction strategy, and continued support and funding for measures like this is an important way out of our epidemic. There is hope for recovery, but we must act on preventing the spread of fentanyl, and we have to stop the